In this video we want to look at the basic structures of the heart. And the heart is going to be lying in the thoracic cavity at about that kind of angle. And this surface here where my hand is would actually be the diaphragm. And round about the heart there's the pericardial sac, the outer layer of which is made of tough fibrous tissue, and the pericardial sac actually connects onto the diaphragm below. And we see there's an arrangement of small blood vessels around about the heart. These are called the coronary vessels because the idea is they look like a crown crowning the heart. So in red we see the coronary arteries and in blue we see the coronary veins. So these form a crown around the heart, if you've got the imagination to see that. And then what we notice now is that this is the left side here and this is the right side here. And the first thing we want to look at are the chambers on the top, the left and the right atrium. So we can take off this side here, and what we're looking into here now is the right atrium. So this space is the right atrium. Sometimes when you start learning about the heart, you learn that the heart is a hollow muscular organ located in the thoracic cavity, and we see it's hollow because it contains 4 chambers. So the right atrium here, the other atria can be visualised at the back here. It's not actually at the back, this is actually the left atrium here. This is the left atrium. Now the atria are the collecting chambers. They collect blood. So blood is going to go into the right atrium via the superior vena cava, and we might be able to see the entrance in red there to the superior vena cava. So blood from the superior vena cava is draining downwards back into the right atrium, and also draining the bottom half of the body. This orifice here is representing the inferior vena cava coming from below, and we can see that this also, from my finger, also drains into the right atrium. And round about the right atrium we can see that there's a thin muscular wall. This is made of myocardial tissue, and this is the atrial myocardium. And on the left side, on the left atrium, we can see the same thing, a thin layer of contractile cardiac muscle forming the atrial myocardium. Now we saw that the superior and inferior vena cava fill the right atrium. What about the vessels that drain into the left atrium? Well, these are the vessels that come from the lungs. And there's actually 4 of them, and they're in red on this model because they carry oxygenated blood, and these are the pulmonary veins. So pulmonary means to do with lungs. These are the 4 pulmonary veins draining oxygenated blood back into the left atrium. Now the heart actually contains 4 chambers, and the 2 bottom chambers are the ventricles. And here we see a cutaway section of the ventricles. Now what we notice here is that the myocardium is thicker. So this is the right ventricular wall. This is the left ventricular wall. And actually, when you see a real heart, the left ventricular wall looks even thicker than it is on this model here. And here we see another area of cardiac muscle, another area of myocardium. This is the cardiac septum. So this space here is the right ventricle. This space here is the left ventricle. And we can see that the walls of the ventricles are thrown up into folds. Here on the left, for example, and here on the right. These are papillary muscles. And they're connected to these tendinous cords, chordae tendineae. So the chordae tendineae here are these tendinous cords connecting the papillary muscles to these structures here, which are the valves. And this valve here, I think you can see, is between the ventricle and the atria. So that is the right atrioventricular valve. And you can see that that allows passage from the right atrium through to the right ventricle. And this right atrioventricular valve has got 3 cusps, so it's referred to as the tricuspid valve. In the same way, connecting the left ventricle and the left atrium, and again we can see that this is communicating through. I put my finger through there. And this valve here is the mitral valve. And because it contains 2 cusps, it's sometimes called the bicuspid valve. But its correct name is the mitral valve. So blood will return from the vena cavas into the right side of the heart, from the pulmonary veins into the left side of the heart, and when the heart is relaxing, this blood will just go straight through, starting to fill up the ventricles. That will allow the ventricles to expand, stretching the myocardium around about the ventricular wall. Then, when the next cardiac cycle starts, the atria will both contract, forcing blood under pressure through from the atria to the ventricles at the same time. So atrial contraction will fill up the ventricles with blood, stretching the ventricular myocardium further. Then the ventricles will contract, and they contract in the way and up the way, and also the heart will twist a little bit when it contracts. And as the ventricles contract, that's going to increase the pressure of the blood within the ventricles. Now, when the pressure of the blood in the ventricles increases, that's going to slam shut the atrioventricular valves. So the increase in blood pressure in the ventricles will shut the mitral valve and will simultaneously shut the tricuspid valve. And that makes a sound that's traditionally referred to as a lub. That will eject the blood through the arteries, through the arterial valves. So here we can see this valve here with 3 cusps is between the right ventricle and this artery here on top, which is in blue because it carries relatively deoxygenated blood. This is the pulmonary artery. This is the main trunk of the pulmonary artery, leaving the right ventricle. And we see this divides into 2 because one branch goes to each of the 2 lungs. At the same time, the left ventricle is going to contract, ejecting blood through another valve with 3 cusps. This is the aortic valve. So the pulmonary valve is between the right ventricle and the pulmonary artery, and the aortic valve is between the left ventricle, this space here, and this vessel here, the main artery supplying blood to the body, which is the aorta. And from there blood goes into all of the systemic circulation. And we actually notice here there's a small connection between the pulmonary artery here and the aorta here. This is called the ligamentum arteriosum. Ligamentum arteriosum. And that's not actually active in adults, but in prenatal life, before you were born, when you were a fetus, then that was patent and referred to as the ductus arteriosus. And the ductus arteriosus would carry right ventricular blood into the aorta, so the blood will go from the right ventricle to the pulmonary artery to the aorta, or a lot of it would, because you don't want a lot of blood going around the fetal lungs. But when the baby starts to breathe, that should close off, and in later life it's the ligamentum arteriosum. The thicker left ventricle is going to generate systemic blood pressure, and you probably know that systemic blood pressure is going to be about 120 millimeters of mercury over 80 millimeters of mercury. So when that contracts, it's developing a pressure of 120 millimeters of mercury. But the right ventricular myocardium, which is much thinner, generates a much lower blood pressure in the order of 25 millimeters of mercury. So the pressure in the pulmonary artery is going to be about 25 over 8 millimeters of mercury. We've already mentioned there's a tough pericardial sac around about the heart and a smoother pericardial layer under that. There's the myocardium, and the inside of the heart is lined with smooth vascular endothelium, and this is the endocardium. So the layers are the pericardium, myocardium and endocardium. So we see the four chambers of the heart, and we've described the blood flow from the atria through to the ventricles. When the ventricles are contracted, the blood is ejected into the major arteries. But actually, just after that, some of the blood does try and get back. It tries to flow back. And that's what these arterial valves are for, to stop the blood flowing back from the arteries into the ventricles. And the back pressure of blood slams these arterial valves shut, and that makes a noise called a lub. So the atrioventricular valve shut, causing a lub, and when these contract, that causes a dub. A dub, I should have said a dub. So it's lub, dub, lub, dub are the heart sounds. So there we have the basic structure of the heart and the basic flow of blood through the right side of the heart, pumping blood to the lungs, and through the left side of the heart, pumping blood to the body via the systemic circulation.